تمام، أعتقد كذا واضح إن شاء الله. بسم الله الرحمن الرحيم. السلام عليكم ورحمة الله وبركاته جميعا. معكم عبد الله التويجري. أنا مقدم الليكتشر هذه إن شاء الله. This is my Snapchat channel at medical_knowledge and Twitter Abdullah1_MD. In the beginning, I would like to give my big thanks to my way ER and ACU for this second opportunity to allow me to present such an important lecture about ABGs. Let's get started. So today's objective is to introduce the ABGs and to know the difference between ABGs and VBGs. Just for those who don't know what is ABG. ABGs is arterial blood gases, okay? So we're gonna know what is the difference between arterial blood gases and venous blood gases. And we'll go through ABG's components and respiratory and metabolic acidosis and alkalosis. And we have something very important. It's about compensation and what is anion gap. And lastly, and most importantly, the respiratory failure, okay? Let's get started. These some references you should know. You shouldn't memorize all of them. Just focus on some, like for example, read and try to memorize this number. Sodium and potassium chloride, zinc, phosphate, calcium. These components present in the EBG's paper. So when you watch the EBG's paper, you should know these references at least, okay? This is, I've took it from a patient. It's a real patient EBG's paper. As you can see here, this is the patient sample report. Status is accepted. This is arterial blood gases, not venous blood gases, okay? Here we have the patient ID and so on. These are our components. Here what we go through, we can know if the patient having any abnormalities in either respiratory or metabolic acidosis or alkalosis. So here we have it, the pH and carbon dioxide and oxygen and of course bicarbonate. These four components we should know very perfectly, okay? Okay, what is the difference between ABG and VBG? Why some doctor request ABG and some request VBG? There is no much difference between them, but most doctors request VBG because it's less risky than ABGs, less vascular injuries, less nerve damage. As you all know, in anatomical perspective, the artery is much deeper than the vein. So in cases of artery, we're gonna have some risk in case of vascular injury or nerve injury and so on. The main differences between ABG and VBG is the oxygen and carbon dioxide saturation. It will be lower in VBG. That's it. But you can get your result from VBG only. You don't have to take ABG if you couldn't. You can just go to VBG, okay? So the main differences is oxygen and carbon dioxide saturation. It will be lower in VBG. But as a gold standard, it's the EBG, okay? At more accurate, I can say, it's EBG. So what is EBG's components? First of all, we have partial pressure of oxygen. It's الضغط الجزئي للأكسجين، تمام؟ وش وظيفته الأساسية؟ إنه يقيس ضغط الأكسجين المذاب في الدم، تمام؟ يخبرنا عن طريقة انتقال الأكسجين من الرئتين إلى الدم. طيب، البارشال أكسجين، البارشال بريشر أوف أكسجين، كم المعدل الطبيعي؟ من 75 إلى 100 ملي جرام ميركوري، أوكي؟ الكومبوننت الثاني اللي هو البارشال بريشر اوف كربون دايوكسيد، الضغط الجزئي لثاني اكسيد الكربون. وش وظيفته الاساسيه؟ انه يقيس ضغط ثاني اكسيد الكربون المذاب في الدم ويخبر عن طريقه كيفيه انتقال ثاني اكسيد الكربون من الرئتين الى الدم. طبيعيا كم؟ من 35 الى 45. الحاجه الثالثه اللي هي درجه الحموضه اللي تسمى pH. دائما تشوفونها pH، هذه درجه الحموضه. هذه تقيس مدى حموضه او قاعديه الدم، تمام؟ تبين الحالات هل في اسيدوسس او هل في الكيلوسس. الحالات اللي ينخفض فيها البي اتش شو نسميها؟ نسميها اسيدوسيس. الحالات اللي يرتفع فيها البي اتش نسميها الكيلوسيس. طبيعيا كمل البي اتش من 7.35 الى 7.45. بعدين عندنا اللي هو البايكربونات اللي هو ثاني كربونات، هذا حاجز للدم يمنع حدوث الحالات اللي ينخفض فيها البي اتش الدم. طبيعيا من 20 الى 29 او احيانا more accurate من 22 الى 26. 29 is higher. okay so طبيعيا من 22 الى 26. بعد كذا عندنا oxygen content، محتوى الاكسجين، هذا يقيس كميه الاكسجين في الدم. طبيعيا كم؟ 15 الى 22. بعد كذا عندنا oxygen saturation، الاكسجين المشبع، هذا يقيس كميه الهيموغلوبين في كريه الدم الحمراء. طبيعيا من كم؟ من 95%. اوكي تقريبا الاكسجين ساتوريشن ما في احد يدخل الاي ار وياخذ علامات او الفيتال ساينز اللي يقيس الاكسجين ساتوريشن. طبيعيا 95 الى 100. هذه الكومبوننت اوف ABGs. You must memorize them. You must know them very perfectly. Okay. The same thing. These are the normal value: pH 7.35 to 7.45, carbon dioxide 35 to 45, partial pressure of oxygens 80 to 100, bicarbonate 22 to 26, oxygen saturation 95 to 100. Okay. Now we go to our subject, the main subject, acid-base balance. We have two cases. We have respiratory conditions and we have metabolic conditions. In cases of respiratory, we always relate it to the respiratory system. Okay. We have two conditions: acidosis or alkalosis. Okay. Let's go through it. So respiratory condition, acidosis or alkalosis. First of all, the acidosis. You're going to look at the pH and you will find it less than the normal, less than 7.35. This is considered acidic. So this is the first one. Second thing, you're going to look at the bicarbonate. You will find the bicarbonate more than 26. بالعناية أنا سويت highlighting للبيكربونات والPH عشان تركز عليهم. تمام. I need you to focus on these two things. First of all, you look to the pH and then you go to bicarbonate. If you find it high, more than 26, okay, you're going to say it's respiratory acidosis, despite the number of carbon dioxide. Okay, so need you to focus on pH and bicarbonate. Okay, what is the etiology of respiratory acidosis? We have drug like morphine or in general anesthetic drugs. We have disease like asthma, COPD, ERCD, acute respiratory distress syndromes. We have myasthenia gravis. Okay. I think it's not. Okay. So we have myasthenia gravis. These are the disease come with respiratory acidosis. In the opposite, we have respiratory alkalosis. First of all, you're going to look at the pH. You will find it more than 7.45. Okay. And then you're going to look at bicarbonate. You will find it low, less than 22. Okay. So this is case of respiratory alkalosis. What is the etiology of respiratory alkalosis? Stroke, PE, meningitis, high altitude, anxiety, anemia. Okay. So these conditions come with respiratory alkalosis. Okay. So this is our first part of the lecture. Respiratory condition, acidosis, alkalosis. You're going to look at the pH in both of them. Here you'll find it less than 7.35. Here you will find it more than 7.45. Okay. And you're going to look at the bicarbonate here. It's more than 26. Bicarbonate here less than 22. Okay. Despite the number of carbon dioxide. It's important, but always go after pH, go to the bicarbonate. Okay. Next. Metabolic conditions. Always we relate metabolic conditions with the kidneys. Okay. Metabolic as well as respiratory, we have acidosis and alkalosis. Almost the same, but we have difference in number. So metabolic conditions, we have metabolic acidosis and metabolic alkalosis, right? So in case of metabolic acidosis, you're going to look at the pH you will find it's acidic, less than 7.35. Here, the next step is to not look at the bicarbonate, okay? To look to the carbon dioxide, okay? In case of respiratory, we said you're gonna look at the pH and you go to bicarbonate. But here, you're gonna look next to the carbon dioxide, okay? So pH is low. You're gonna look at the carbon dioxide and you find it's low, okay? You're gonna say it's metabolic acidosis, okay? Etiology of metabolic acidosis, it depends on the anion gap. We will know how to calculate it later on. If it's high anion gap or if it's normal anion gap. If it's high anion gap, we have DKA, diabetic ketoacidosis, lactic acidosis, renal failure, hypoaldosteronism, toxic like in case of ethanol, okay? If normal anion gap, we have some condition like diarrhea, renal tubular acidosis, okay? So this is case of metabolic acidosis. What about metabolic alkalosis? You're gonna look first at the pH, you will find it's alkalotic, more than 7.45, and then you're gonna go next to carbon dioxide. You will find it high, more than 45, okay? So pH and then carbon dioxide. What is the etiology of metabolic alkalosis? We have vomiting, we have drug-like diuretics, we have a case of hyperaldosteronism, okay? These two cases of metabolic conditions, it's either acidosis or alkalosis. Acidosis, pH less than 7.35, here pH more than 7.45. Next, you're gonna look at the carbon dioxide. It's less than 35 here in acidosis, in alkalosis, more than 45, okay? Okay, acid-base or acid-base compensation. What do we mean by compensation? It's normal physiological mechanism to compensate to allow the body, our body to compensate for these abnormalities happen, okay? We have three contents: full compensation, partial compensation, and uncompensation. How we will know these things, how we'll decide it if it's full compensated or partial compensated or uncompensated, okay? Compensation guideline, okay, look at the pH, okay? If it's abnormal pH, and you're gonna look at next, one of these, it's either partial pressure carbon dioxide or bicarbonate is abnormal. معناته ايش؟ معناته انه تشوف البي اتش تحصلها غير طبيعيه او انها abnormal سواء acidic او alkalinic، وواحد من الاثنين هذول يا اما الكربون دايوكسيد يا اما البايكربونات abnormal غير طبيعي. خلاص؟ يعني بي اتش مع واحد من الاثنين هذول غير طبيعي والثاني طبيعي. احنا عندنا 3 components صح؟ اثنين منهم يكونون غير طبيعيين وواحد منهم يكون طبيعي. This is called uncompensated, okay? لكن لما يكون النورمال بي اتش تمام؟ خلاص despite the result of other carbon dioxide and bicarbonate you're going to say it's full compensated, okay? خلاص البي اتش طبيعيه full compensated, okay? لكن لما يكون عندك ال 3 components الثلاث اشياء كلها غير طبيعيه بي اتش والكربون دايوكسيد والبايكربونات كلها غير طبيعيه خلاص you're going to say it's partial compensated. هذه 3 cases of compensation. It's either partial compensation, all of them are abnormal, full compensation, pH is normal, uncompensated, 2 results or a pH and one of these normal and the other is abnormal, okay? Anion gap. How to calculate it? You're gonna see the result. I've told you in the beginning of the lecture, it's better to know the values of sodium and potassium and chloride and bicarbonate. In case if you want to calculate the anion gap, okay? So you're gonna take sodium and plus potassium and minus